Like I said, welcome back to Session 8 of our Emergency Operations Center and Government Talks Readiness series. Today, we're going to explore how to identify unmet needs through the response and recovery operations and how to utilize the mission tracker to manage needs, requests, and offers. Luke Beckman, our Division Disaster State Relations Director with a focus on California, and I will be your presenters today. My name is Sherry Lewis, and I am Luke's volunteer partner. Throughout the first half of this series, we've looked at a lot of topics. Let's do a quick run through and bring us up to where we're at today. Session 1 included the series introduction and what you should know and how you should prepare before you arrive for your assignment at an emergency operations center. Luke took us through the perfect disaster response that we strive for in Session 2. And in Session 3, Megan and I covered what to do when you arrive at the Emergency Operations Center and the tools we use to successfully do the job well to communicate in real time. During Session 4, Nadine McCrindle shared her expert tips on how to build rapport and the importance of networking and relationships. We took a deep dive in what to do before, during, and after meetings in Session 5 so they're effective and most importantly make the best use of all participants' time. During Session 6, we examined what situational awareness is useful for us to gather and share with the Red Cross Disaster Relief Operation. It's hard to believe that we've already been through more than half of this series already. Last week, we heard our government partners from the state of California and Santa Cruz share with us what situational awareness is most useful for them to receive from the Red Cross. Today, we're covering unmet needs and how to use the mission tracker. Next week, we're going to dig into part 1 of facilitating engagement with our community partners. How to identify them to collaborate and satisfy those unmet needs that we're going to be talking about today. So the fourth quarter of the series will wrap up at the end of the month. During Session 10, we'll be looking at how best to facilitate conversations between our community and government partners by considering who the stakeholders are, their interests, and the roles of each agency in the conversation. Session 11 will include an in-depth look at how we want to leave our assignment, the information we'll share through the tools we use, and pending items that require action so the operation won't be negatively impacted by transition. We'll be bringing all of the skills we learned and using the tools we acquired to an exercise in our final session on March 29th to wrap up the series. So today, what do we consider an unmet need? It's really simple. First, we ask if the operational area, the OA, can satisfy the need themselves. When the answer is no, this identifies an unmet need. We've talked about unmet needs in previous sessions, and today we're going to talk about what they are, how they're identified, what that means to the disaster response operations, and our role in how the needs can be satisfied effectively and efficiently. We're going to take a close look at those unmet needs related to mass care, including sheltering, feeding, healthcare, mental health care, and needs of clients with access and functional needs. Wraparound services and other unmet needs may also come into the conversation and be considered. So, what are some unmet needs we might identify and track during the recovery phase of the disaster? Right away, we run into those roadblocks our clients face that prevent them from moving out of the shelters. Some of those factors include housing inventory, or lack of housing inventory, I should say, and those whose pre-disaster address isn't necessarily traditional, like those impacted by homelessness. Delay in insurance or other benefit payouts can cause delays. Home utility or infrastructure repairs can also cause delays. What are some others? And to enter some others into chat that you have identified or that you've come across during the recovery phase. What are some of those unmet needs that prevent people from moving forward? Let me give you a few seconds to respond so we can talk about a couple. Can you guys hear me okay?
We've got you, Sherry.
All right. Great. So what I'm seeing in response is biohazard cleanup, environmental issues, awesome. Transportation, huge. That's a huge factor. Language barriers, another one that comes up throughout response and recovery. Loss of ID, another one that is very challenging and tricky. Access to the area that's been destroyed, exactly. Lack of affordable housing. Yeah, housing inventory seems to be a repetitive tune that we're hearing more and more often as there's just less homes available for people that need them. No employment, income to secure housing, medical impairment, all really, really true and valid unmet needs that we have to collaborate to satisfy together. So like our previous sessions, we're going to apply the listen, think, communicate mantra throughout the process of identifying unmet needs and tracking their progress. We're going to listen to identify the unmet needs anywhere we may gather the information. It could be during meetings with our partners, in situation reports, based on details found in IAPs, partners supporting the community, social media, news reports, and others. Once we've identified unmet needs, we're going to think about them and validate them. We're going to vet the source of the information, confirm details, and determine the actual needs that need to be satisfied. Once we've determined there is an unmet need and the scope of the need, we'll consider which partners may be able to satisfy the need. Finally, we'll communicate the information to the disaster relief operation and our partners. We'll facilitate meetings with our partners to satisfy the needs, and we'll track the progress and tools that provide real-time information to the disaster relief operation and our partners if possible. So let's talk a minute about how we can identify unmet needs at shelters. Let's see some answers in chat. How have you heard about unmet needs at shelters? You might be a shelter worker, or you might be a coworker that's working within a shelter or supporting a shelter. So let's see in chat, how have you heard about some unmet needs? Drea, that's a very good one, chatting with clients. Of course. CMIST. Definitely the process that we use to go through how to identify needs. Diane, I'm going to ask you to come off mute really quickly and tell us what the CMIST acronym is.
So CMIST stands for Communication, Maintenance of Health, Independence, Services, there's a bunch of S's there, and Transportation.
Excellent. Thank you so much. So we'll be sure to add that to our acronym encyclopedia because it's a fantastic tool to identify those needs. Chatting with service associates and supervisors, of course, through our VOAD partners. VOAD is our volunteer organizations active in disasters. Translators for clients, very essential, and also essential to identify when we need those translators to bring in to help us identify those needs. EOLs, or elected official liaisons. We'll be sure that's in our acronym encyclopedia if it isn't already as well. Shelter resident assessment, yes. Information received from the sheltering manager, and I think that's most vital. So setting up communication with your other work group leaders, having an open dialogue so they know they can reach out to you to communicate unmet needs and start those conversations and start the think process about them. So we're going to hear it through the Red Cross disaster relief operation from our shelter workforce. We may hear about needs from our feeding teams or our other partners. We might hear about needs through social or other media sources. So where do you think we'll find out about unmet needs at partner shelters? Let's see. Yep, IRV drivers, I see Don put in there, exactly. So do you think the sources of us finding out about the unmet needs will be the same at our partner shelters? What are some other sources where we might identify needs for those partner shelters. Deborah, partners, yep, that's a very good point. The partners that are managing the shelter or partners that are help supporting the shelter needs. Itinerating staff. I don't know why that word itinerating is so challenging for me, but I appreciate the opportunity to practice. Thank you, Diane. Faith-based groups, exactly. Those in the community who are in touch and communicating on a regular basis with those partner shelters. We may hear about needs at those shelters also from our government partners because they may be providing some support or they may be in regular communication with those partners. So what are some unmet needs that come up at shelters? There's a ton of them. So just give me a few of them in chat and we'll look them over. In the last couple of years, PPE or personal protective equipment has been a huge request that comes up. Sometimes it's in limited supply. Sometimes we have an overwhelming supply that we don't know what to do with. Also think about people needs. A lot of times what we need most is people. So Mary throws in chat, medical needs, wheelchairs, etc. Special diets, very good point. We're going to talk a little bit more about feeding in a minute. Ethnic service providers are a good way to find out about concerns about ICE or impact on immigration status to keep immigrants from shelter or applying for assistance. So reaching out to those people to identify the populations of folks who may be in partner shelters, but not necessarily in some of our other shelters for different reasons. ADA, showers and toilets. Oh my gosh, huge thing that comes up always at the beginning of a disaster and seems to always be hard to get our hands on. Tools, supplies to help clean up clients' houses. Exactly. So do we respond differently if the unmet needs are identified at a partner shelter versus a Red Cross shelter? See some responses in chat. Aaron says yes. Diane says no. So this is something that's really debatable, right? So the correct answer is we don't respond differently necessarily in the fact that we still identify the need, we still validate and gather more information about the need, and then we collaborate to satisfy the need. Red Cross may satisfy the need, or it may be a partner that satisfies the need. So that's where the confusion comes in. Sometimes people will say, we respond differently if we're not the one actually satisfying the need. But we're really here to facilitate meeting all needs, even if it's not the Red Cross satisfying it. So thank you guys for all of those wonderful responses. They're all accurate. So many challenges come up in our efforts to feed people who've been impacted by disaster. Many of you on this call have experienced some of those challenges. Some clients are eating some or all of their meals at the shelters. Others rely on mobile feeding because they have a place to stay, but they're not able to prepare food. So we're going to find out from a lot of the same sources what our unmet feeding needs are as we did finding out what our shelter needs are. But there are some other ways we may identify unmet feeding needs. So I want you guys, with a focus on feeding, throw some responses into chat for us to consider. What are some other ways that we could find out about some of the feeding needs that are out there in the community or other feeding activities that are happening out in the community? Anyone have any ideas for me? Food banks, ooh, that's an excellent one. Looking up the demographics, yep, ask, perfect. Prepped food or perishable food. Reaching out to our ethnic partners. The state feeding task force, woohoo, thank you, Deborah. identifying different ethnic needs and medical diets that are out there. FBOs, 211 calls metrics, exactly. So our feeding partners, our IRF drivers, our distribution of emergency supplies workforce. Someone earlier mentioned our itinerating workforce. Our disaster action teams are going to hear a lot of information regarding feeding needs when they're out in the community and making touch points with people. They're also going to see other partner feeding organizations who may be set up. They may discover the little pop-up vendors that are supporting the community, but also impacting the plans of our feeding teams if we're sending people out with food that's not needed in a particular area or at a particular meal period. So people working at the resource centers, churches, and other local community hubs will usually know the populations of people that may not be able to access current feeding efforts or are hesitant to seek our support. So really reaching out to the community and understanding all of the different places that people communicate and set up networks with one another. That's where you're going to find that information. So it's essential we understand the process for the operational area to communicate and escalate the unmet need requests to partners who can satisfy the need when they're not able to. Like all disasters, the process starts locally. As we discussed earlier, we first ask and listen whether the OA or operational area is able to satisfy the need themselves. If not, this is what we consider an unmet need. Next, we think or determine whether the need can be satisfied by local partners like the Red Cross DRO, other partner operations, or community partners. Then we figure out which partners should be brought together to satisfy the particular need. Finally, we facilitate meetings appropriately to bring partners together so plans can be communicated and executed to meet the need. If it's determined that the unmet need cannot be satisfied locally, the need should be escalated up to the state so it can be addressed by state and/or national partners. The operational area and the state should have a system in place like Web EOC that's used to communicate unmet needs from the operational area up to the state. Systems can differ by operational area, so you need to identify this process at the start of your assignment so you can help facilitate unmet needs requests. Some operational areas may not have a lot of disaster experience, and it may require you reaching out to the Red Cross representative at the State Emergency Operations Center or the SOC to find out what the process is so you can help the operational area make the request in a timely manner. Then, at the state level, we figure out which state and/or national partners should be brought together to satisfy the need. We facilitate meetings appropriately to bring partners together so plans can be executed. Here's a screenshot of the requests being managed in Kentucky when I was there. As mentioned previously, the request system may vary based on the operational area, so it's part of your assignment to find out what system is being used and what role you have in monitoring, managing, and/or facilitating work in the system. What information should we share with partners to collaborate and satisfy unmet needs? This comes from experience and a lot of going back to ask and listen for more answers that are needed from partners to consider and satisfy needs. So let's review the most common questions we can answer and how those might look. Let's start with the who. Who needs the thing that will satisfy the request? This could be one person or a group of people, but it must include as much detail about the people as possible, so as many supporting agencies as possible can be brought into the collaboration. For example, if there are 100 people who were evacuated from a medical facility in a rural area and they lost their durable medical equipment, we can immediately engage state agencies to start working on solutions, especially if we know the local area and community will not be able to fill that large of a need immediately. The request can be initiated immediately with the support of the big guns at the state. Sometimes the who will create opportunities for more assistance. For instance, when the population impact have access and functional needs, we need to consider all levels of support that are immediately available, including those at the state and national level. These are folks who cannot always advocate for themselves, and we need to be sure that we have all hands on deck to support their needs. So, what about the what? In the case we're using as an example, we need to gather a list of specific durable medical equipment items that are needed by those 100 individuals. The list should be itemized and requested via the appropriate system for immediate action. The list should include all pertinent details so the request can be filled as efficiently as possible. Are there sizes or quantity that should be included? Are there other specific needs to consider when filling the request? Next, when should the need be satisfied, or what is the urgency of the request? Is this a medical need? How urgently is the item needed to satisfy the need? Is this something that we expect to run out of today, tomorrow, next week, or is it something that we need right now? Determine the urgency and share with partners so they can determine whether they can meet the need and commit appropriately. Where are the what's going to satisfy the need? After it's determined who needs what and when it is needed, we need to know where the needs are. We should determine as many specifics as possible, like where the needs are, whether it is one site or multiple sites, whether there is a point of contact at the sites, site details like whether there is a forklift for large deliveries, a warehouse or other site details. Is there labor to help load and unload? How will the need be satisfied? Will it require multiple agencies to coordinate when the process is considered from sourcing to final delivery to the client? Document the process to identify any gaps in the process to troubleshoot collaboratively with partners contributing to satisfying that unmet need. We need everybody's buy-in to make it happen effectively and efficiently. So we've identified the unmet needs and considered the who, what, when, where, and how. The next step is figuring out what partners should be brought together as efficiently as possible to determine whether a need can be met locally or whether it should be escalated to the state. This is when the detective work comes into your assignment. Every operational area is different and has different resources at hand. Some operational areas have a lot of experience at disaster response, while others have no experience at all. One of the trickiest parts of your assignment may be determining how much experience the operational area has and how you can support their efforts by providing your subject matter expertise. Or, more importantly, you knowing when to bring someone else in with more expertise if you don't feel you have the skill set necessary to support the operational area confidently. This might be the very first unmet need you identify. After identifying the agencies you're working with on your assignment, determine which may be able to satisfy or support satisfying the unmet need or needs. Collaborate with them by sharing the details you have. Ask if there are other supporting agencies or a COAD, community organizations active in disaster, or a VOAD, like we mentioned earlier, that have been activated and could support meeting the need. What tools are being used to track the needs? Is there a web EOC system being used? Who has access? Are there established COAD and VOAD meetings on the schedule to discuss unmet needs, or can they be started? Again, once all the local resources have been exhausted, what tools are going to be used to track the request and escalate it to the next level? How is the need being tracked by the Red Cross disaster relief operation? Some of the answers may vary by operational area, but the tools we've talked about throughout this series should be utilized, including the activities log, point of contact workbook, and the mission tracker that Luke will give us a look at very soon. So we've talked a bit about emergency support functions, but we haven't had a lot of time to go into detail. They're the main functions by which the federal government and its partners organize themselves when responding to a disaster. The National Response Framework lists 15 emergency support functions. States, tribes, territories, and localities, the local operational areas, also often organize themselves by emergency support function during a response, and they may have a different number of ESFs than the federal government. So typically, one or more agencies are designated as the lead agencies for a given ESF. At the federal level, the Red Cross is designated as the co-lead for the mass care portion of ESF 6. Mass care, emergency assistance, temporary housing, and human services. The Red Cross is a support agency for other ESFs. The Red Cross role in ESFs varies across states, tribes, territories, and localities, like I said. EOCs and other coordination facilities will often organize themselves that way, and Red Cross liaison will often sit in the ESF 6 seat. So though most of what Red Cross does is directly related to ESF 6, we'll frequently collaborate with the agencies supporting other emergency support functions as the unmet needs overlap into each other's purview. We'll share the slide deck after this session in the follow-up email, and it's important that we identify and understand the ESF structure of the operational area we're working in so we can identify government partners that may be able to contribute to satisfying those unmet needs, or connecting us with partners that might be able to satisfy those needs. Now, as promised, Luke is going to give us the nitty-gritty on the use of the mission tracker, how to use it successfully. So Luke Beckman, take it away, sir. We cannot hear you.
It was taking a second. Good afternoon, everybody. I'm joined here by my fearless assistant, Nico, who is eating while we go. So if you hear something, it is all part of the plan. What we wanted to talk about is the mission tracker today. What is the mission tracker? Sherry, if you could go to the next slide for me, that would be extremely helpful. Thank you. So the mission tracker is quite simply, it is a SharePoint list that we have linked into and that we will continue to link into each DR's Teams site. So we're basically creating an interface for everybody to work around a SharePoint list. That's what the tool is. But what really is the tool? Okay, I get that it's a tool, but what is this? Think of the mission tracker as a task or a project tracker on a disaster relief operation. This is a one-stop shop. That's our intent. A one-stop shop of what, you say, Luke? It's a one-stop shop for any time a partner asks us for something or offers us something. Anytime that we identify an unmet need in the field, these are all candidates for a mission. Now, the Red Cross may decide that we're not going to touch that mission. We may reject it. We may decide that that mission is better accomplished by a partner. We'll bring a partner to the table and the partner will action the mission. Or we may decide that this is something for mass care, right? For feeding or for health services. It may be something that's just for logistics. We just need to procure some supplies. This could be something for fundraising at the end of the day, right? If a partner asks us or offers us something, it could be in-kind donations. So just because a mission comes in doesn't mean that the Red Cross is going to automatically do something. We still have to work it through the process. So we update missions as we go. A mission comes in and 10 people could collaborate on a single mission. It could be 100 people, or it could be one person. So once the mission is here, this is simply a way for an ask, an offer, an unmet need to not disappear in our email, to not disappear on a post-it note on the wall of DRO headquarters or out in the district, or for it to not disappear on your notepad as you're driving around and you've got 100 different things to do for the day. This helps us ensure constant accountability and responsibility so that we don't drop things. I'm sure we've all, and I'd actually like to see by show of hands. So go ahead and raise your hand and then we'll put it down in a second. Raise your hand if you have ever been on a disaster relief operation and something has hit your plate, or you know of something that's hit the Red Cross's plate and we lost it. It disappeared. It went missing, or we didn't action it fast enough because we were so busy. I'm going to raise my hand because that happens to me all the time, and I'm seeing a lot of hands go up. So this is just natural, right? This happens to everybody, every human on every disaster. We've got like 40 hands up. This happens all the time. What we're trying to do with the mission tracker is have less of that. And we've actually seen with demonstrable results, we've seen this be very, very effective. So let's talk about, well, who gets to create a mission, Luke, and what happens with it once it's created? Go ahead and put your hands down. So a mission can be created by anybody. The tracker is open to anybody on a relief operation, but most of the time, a mission is going to be created by external relations. Missions can be actioned by anybody. Anybody can work on a mission, but usually it's going to be external relations will always kind of be tracking and following along with the missions. That's who's looking at the tracker all the time. But usually at the end of the day, operations or logistics will end up actioning most of the missions. And as I said before, we use the mission tracker so that we don't drop things. That's really what we're trying to do with it. So what we're going to do today is a little bit of an exercise. And as I always say, when it comes to an exercise and trying new technology, it may work for you, it may not. If it doesn't work, that's okay. If it works for you, I'm going to be sharing my screen so we can see what's happening as people go ahead and input things. What I'm going to do is we're going to spend about 3 or 4 minutes where I show you what the mission tracker looks like. We're going to look at the fields in the mission tracker. And then I'm going to tell everybody how to get to a sandbox that you all have access to today, believe it or not, or that you should. And we're going to have everybody practice entering a mission. And then we're going to have you edit someone else's mission. So we get to kind of test the gears on that. So I'm going to share my screen. Here we go. Working on some projects here. There we go. All right. So what we've done is we've actually created a sandbox mission tracker in our Pacific Division External Relations work group. And we've put it in the general channel. And there's a tab up at the top that says Mission Tracker Sandbox. What I'm also going to do is I'm going to open it in SharePoint so that you can see. I've got the wrong thing up here. While I do this, we'll close this out. And we're going to open it in SharePoint. And as we go through, I'm going to put this link here because I know some of you may not be able to access it through the team. And this is going to just ignore the man behind the curtain for 1 second. I'm doing this one-handed, and there is a link for it. And so I'm going to go back to the sandbox. This is what the mission tracker, a blank mission tracker. It's the first hour of a disaster relief operation. It's just been created by the external relations team in the region. That's who's going to create a mission tracker for each relief operation. So it's been created by the team. There's nothing in it, but this is exactly what it's going to look like for you. Now, I'm lucky I get to create the first mission. So I'm going to click New in the upper left there, and there's a whole bunch of fields, but not too many. We have been testing these fields on dozens of relief operations over the last probably 5 or 6 years in hit or miss, but this is the first time where we're going to be doing this consistently across the board in the Pacific Division. In the State Operations Center, we use this all the time. During COVID, we've been using it nonstop as missions come in from local, state, and federal partners to make sure we don't drop things. So the first thing is there's a request owner, name, number, and email, and that's one line. We've been very deliberate about how we've created each field here. If it's a dropdown, there's a reason. If it's a free text field, there's a reason. If it's a date field, there's a reason for that. So the request owner, this is who in the Red Cross is working the mission right now. If I have a question about this, who do I call? I'll just go ahead and put in Luke here. That's me, right? We'll go ahead and excuse the single-handed typing. There we go. So I've got this. Now I could put in my number and email, but let's do the status. So the first things first, when a mission comes in, it doesn't have a status. It just says no action taken. We haven't done anything. But as soon as someone starts working it, we would actually flip the status to maybe reviewing. We might realize that there's no action required. We could reject the mission, but more oftenly, we will probably refer that to a partner organization. Very few missions get outright rejected. We might accept the mission, and then hopefully, if we have reviewed it, if we have accepted it, and we've worked and completed it, then we get to mark it complete. That's the hope, right? That the mission works all the way through the process. well, let's say I'm reviewing this one. And the request title, what is the mission? What's a nickname for it? So I'm going to say this mission is going to be feeding support at the LAC, the Local Assistance Center. I'm going fast, so I'm just going to use an abbreviation here. And we have a space here for the description of the request. Usually, you're going to find that the mission came in via an email. Maybe it was notes on a conference call. Maybe it was a text message. So if you get an email, you could actually go in here, hit edit, and you could paste the whole email in so that we see all of the nitty-gritty details of the mission. Then there's a start date. When are we starting to work on the mission? And now that start date always is going to default to today, whatever today is. So you notice here it's March 1st, defaults to today. But we may realize that, well, this feeding thing doesn't need to start for a while, but we need to start planning it. And we're going to start planning it tomorrow. Okay, so I moved it to tomorrow. Now, who asked for the mission? Well, was it the Red Cross, another unit in the Red Cross? Was it a government agency? Was it the partner organization or somebody else? So this is just to help us understand who's asking things of us. So I'm going to put partner organization. Then the requester, who has asked it, who specifically has asked us? Because how many times have you been out there where somebody says, well, I was talking to the city council, and the city council said, Red Cross, we need you to feed at the LAC. Actually, so we'll go with this example, the city council. So this is the government. The city council said, we need you to feed at the LAC, and you forward it on to somebody. And at the end of the day, the Red Cross says, hey, great, we're ready to feed at the local assistance center. Who's our point of contact? And everybody scratches their heads and says, I don't really know. And then we spend hours trying to figure out who asked for this in the first place. That's what this field is for. So I'm going to say Jim Jones. Jim Jones asked us, and we could put in his number. There's his phone number, and we could put in his email. Now, what activities does this involve? This helps us understand who's working the mission. And if you notice, we have all the activities in here. Now, in this one, we know that feeding is working it. We know that EOL is working it. And you notice it kind of disappears when I click on it. That's because I'm selecting multiple different activities. And we know that government operations needs to deal with it and public affairs. This helps us ensure that multiple teams, and I'll check the checkbox, multiple teams get to work the mission. Now the due date, this is an important one. This is basically when do we need to start feeding? So let's say they asked us and we need to feed on Saturday and the LAC opens at, let's say it's 9 a.m. And we'll do this, there it is. So 9 a.m. This means I need to have this mission complete by 9 a.m. Otherwise we're behind the 8 ball. We failed, we dropped the ball, whatever you want to call it. We want to know, where is this happening? This is happening in anywhere. We're gonna anywhere California. All right. And the county, this is a free text field. Let's just say that happens to be in Yuba. Okay. Now, if the Red Cross has districts, we could go ahead and put in a district number here if we need to. But you notice, well, client contact. Well, look, but we have to feed on this mission. There isn't a specific client who we're helping here. This client field, you notice, is not required. Fields that have a little red asterisk next to them, this little red dot, those are required fields. You're going to have to put in information there in order to save the mission. So client information isn't required, but let's talk about where this comes in handy. The most common instance, Diane and I have worked this dozens, maybe hundreds of times over the years, where the Red Cross is asked to provide, say, durable medical equipment or help facilitate the procurement of durable medical equipment for a specific client, and a government partner asks us to do that. This is where we can put in the client contact information. This way we don't have to go through a middleman, the government emergency service coordinator who told us about this. We can contact the client directly if we need to, so that we can support the client and better understand what those needs are. Now, this government mission number, this is if the mission came to us from a government agency and it was already entered into their system. In California, the system, Cal EOC, Web EOC is the common one. You've seen Sherry show lots of examples of this. If the government already has a mission, we can put in their unique identifier so that when we're talking to the government, we can quickly, they can pull it up fast in their system. This one, this request ID, we don't fill that out. You see here, do not fill this out. This auto-populates. You'll see why that's important in a second. We don't touch that. The date completed, well, if we were ready to go on Saturday at 9 a.m. and we finish this, it's finished on the 5th. We could put in a location if this is helpful if you're doing distribution of emergency supplies, if there's a parking lot where we need to drop supplies, or we need to make sure we do a pickup, you could put in a location. And if we have files, planning files, we can enter attachments. So I talked through all this, but generally speaking, creating a mission takes maybe 2 or 3 minutes. I'm going to go ahead and hit save. Oh, you see here, it wouldn't let me save because I didn't fill in this required field. So it catches me. So I'm going to just put test. All right, I'll put test here. I'm going to hit save. So it's populated. I can also save up at the top. I save, and here's the mission. Remember that field where I said don't populate it? Well, it auto-populated mission number 1. That's the first one in our tracker. So when you're talking to Red Cross colleagues about a mission, we could have a dozen feeding missions in here. And so I can't just say the feeding mission in Yuba. I should be able to reference the specific feeding mission. So this way I can say, this is mission number 1. Hey, Sherry, we were talking about feeding earlier. I forget the mission. Sherry tells me, hey, Luke, that's mission 27. I can go find mission 27 very, very quickly. So that's how easy it is to put in the mission. There's only one right now. And if I go over to my web page, you see here, it's on that web page at the same place. So I could save this so that if it's easier for me to work in here, I can do that. If it's easier for me to work in Microsoft Teams directly, I can do that as well. So what I would now like each of you to do is think about any questions you have. We're going to answer some questions first. Then we're going to do this demo exercise where we all create a mission. So first, I'm going to stop sharing my screen. I'm going to look for any questions in the chat, and we'll try and answer as many as we can. Where are recovery and DES in the list of activities? Betsy, great question. I think DES, yeah, Tracy found it, and you may find some things that we have missed, but they should be in there. If they're not, in the next 5 minutes, they will be. Great question. If we send a mission to a partner, who will follow up with them? Aaron, that's a great question. Remember how we said who's the Red Cross owner of a mission? That is the person, that's the responsible person for that mission. So if you send it to a partner, referred to a partner, we're going to look in that Red Cross, or who's that the owner of the mission on the Red Cross side. That's who I'm going to follow up with. So just because it's referred to a partner doesn't mean that it's done and we can wash our hands of it. It's still not complete. So we may refer to a partner. We still may need to make sure that it is completed as a mission. Who determines who should own it? Don, that's a great question. This is where collaboration happens. There is not a single right answer for who owns a mission. This is where you've got to talk to your Red Cross counterparts, and somebody is going to say, hey, Don, I think this falls in your shop. You're going to own this one. But the next one, somebody may say, well, that's Diane's mission. So there isn't a right answer, but this is a challenge we have no matter what it is. If you've got 8 different activities, is anybody responsible for it? There has to be someone who's tracking that mission to make sure we don't drop it. And at the end of the day, where it's usually going to fall, it's usually going to be the external relations person, because it's our butt that's on the line if that mission gets dropped, because we're in that EOC, we're meeting with the partner, and the partner says, come on, Luke, where's the Red Cross? So I've got to stay on the teams to make sure we're either accepting the mission and completing it, that we're referring it to a partner and the partner is completing it, or that we have deliberately rejected that mission saying we're not going to do it, and that we've communicated back to the partner effectively. Diane, is the mission tracker only for use during a DRO? No, is the simple answer. We are going to be using it on all of our relief operations, but we actually have several regions that use a mission tracker for day-to-day activities. So just like a project management or tasking tool, this is something that could be very helpful for you. We could create a template. It takes creating a mission tracker takes about 7 clicks. So we could create one for your region that the region could use for day-to-day activities, if you would like. Aaron, will this be available for partners to enter information of what they did? At this time, no. What we would do is we would have a partner send us an email, and we would take the email, we put that into the description so that we essentially have a running log. This is an internal tool only at this time. These are great questions. Any other questions? Let's see. Can the mission tracker fields be editable if something changes? Diane, absolutely. On each DR, it's possible that you uncover, I mean, think about just change management. It is very easy to change a field, to change what exists in a dropdown, to change what we call something. Maybe we forgot a field and we need to add it. It is very easy to do that. We will be training leads on how to do this if it's required. What we want to make sure, though, is that if one DR realizes something really interesting and needs to change it, that we learn that lesson so that that can get applied to the template that's used across the board. So very easy to do, and that's a great question. All you get is a blank screen. Michael, it's possible that you may not be in the team. We'll work that. And again, as I said, some folks may not be able, because this is a sandbox that we're using. When you're on a DR, you'll have access to this all the time. So if you're not able to get access right now, please excuse any little frustrations, but we'll work through this. Let's see, Barbara, does this integrate into the IEP at all? If yes, what's the process? Right now, Barbara, yes, it actually does, because there are the exact line in the IEP. I wrote the form years ago and I can't remember it off the top of my head, but basically it is task. It's one of the last pages in the IEP where we talk about sort of big, it's not objectives, but it's sort of big tasks that the DR has to work on. Many of those often come from our external relations mission trackers. So it's not like anything auto populates or auto feeds into it. But the process is there. One thing that we'll likely start seeing is a dashboard showing how many missions we have, how many are complete or incomplete, where the mission's based, as part of our director's brief dashboard. Might be nice to have a field that shows the POC info for the owner or partner. Tom, that's a great question. As we play with this, as you play with this, you might have ideas because of your experiences that we haven't thought about, even though we've used this a ton of time, right? Where it's never going to be done, it's never going to be perfect. Shoot those to me directly. My email is luke.beckman@redcross.org. That's BECKMAN. Would all groups have access to the tracker? Yes. The way the trackers get built is anyone who has access to that DR in Microsoft Teams, which is everybody on that volunteer connection roster, everybody should have access to the mission tracker. Sue says, I've seen a job director discuss an update with command staff, the working mission tracker, didn't realize it was connected to ER. Yeah, it's not, we haven't started educating and sort of teaching and training to this division wide up until this point. So Sue, that's exactly right. How does the mission tracker differ from the list in Web EOC? So Web EOC is not a Red Cross wide platform. But if you're familiar with Web EOC and how lists work in Web EOC, it's kind of similar, except this is a free tool that took us 20 minutes to build, and we don't need any tech admins from another company to support it. This is something that we can own and adjust and improve on internally within the Red Cross. So in the state of California, many other states, they talk about mission tasking. You've heard that term a lot of times in this series, and mission tasking usually, that's their version of a mission tracker. So this is our version. All right, would be nice to have a field to know if the mission has been vetted and is actionable. Betsy, that's a great one. And you'll see as we use this, that is part of the responsibility of the person creating the mission, that you vet a mission before you put it in. And so there are times where you may say, oh, well, why did Luke, you dummy, why'd you put this mission in? This isn't actionable. The mission may have been a go on Monday, and then all of a sudden the partner, we see this all the time, the partner says, turns out, just kidding, we don't need to do that anymore. So in that case, the Red Cross would reject the mission because it's no longer a valid mission. It didn't exist. And then Diane, can a specific activity use its own mission tracker, such as ICCTs? We've actually had that in the past. You sure can. We can teach you how to do that, Diane, on the IDC side, going from that parent template. And we'd be working with the activity leadership to be able to do that, to create that mission if required. And we've actually done that with IDC on a number of DRs in the past. Let's see, Aaron, will it be training for all our leadership at some point on how to use it? Absolutely. We wanted to start with this. Within the next 24 hours, you're going to have a link for how to use a mission tracker. And then we're also going to have a very quick training on how to create a mission tracker if you are a leadership team member. Let's see. All right. Could there be redundancies or duplications between WebEOC and our mission tracker? Absolutely, Barbara. You'll see a lot of times if a partner has a mission and they say, Red Cross, you need to take this, they use WebEOC. We might have the mission might be written exactly the same way, but all we've done in that instance is we've taken it out of email, because that's the only way that we would receive it, unless you had a liaison who has access to the WebEOC instance of that partner. But either way, we have to bring that into the Red Cross in order to work that. We should not be, as the Red Cross, working a mission in a partner's WebEOC. We should be updating their status so they can track it if they have given us one. And that's part of the job of working in an emergency operations center. All those people. So Tom, the mission tracker, the way that we've built this, it will live at the general sort of the DR wide instance. It won't just be buried in that ER channel, because it requires all activities in order to be successful. Yeah, Joanne, that's a great point. We use that reviewing status that we have. That reviewing status is what we flip as soon as I enter a mission. Every time I put that to reviewing, that is the vetting process. Only when I have marked accepted, that's when the Red Cross is like, okay, that's real. We're going to take it. We can work it. I might then refer it to a partner. We might then reject it. We might then work it and complete it. So anything can happen, but that accepted says, hey, this is valid. And all of that vetting, I could put that into the description of the mission, but most of that is just going to be me making phone calls, texting people, talking to partners, talking to clients, trying to make sure this is a real mission, right? This is something we need to work on. Great questions that are coming in. Let's all take a look and create some missions in the sandbox. So I will put in the chat again, I will put the SharePoint link so you can see our sandbox mission. If you are able to go in Microsoft Teams so that you get your DR specific example, that's as close as you're going to get to what we do on a DR. What you should do is you should go to the External Relations Workgroup team, go to the General tab, and then click on the Mission Tracker Sandbox. And I see people already doing it. This is incredible. It's working. So what you may see is it might be buried for you in one of these other tabs. So you might have to click on the 5 more, 6 more, but you should be on Mission Tracker Sandbox. And then you're going to see missions start to populate here. So we're going to go ahead, and I'm actually going to stop talking for a couple minutes. But go ahead and, as people go ahead and put missions into the tracker. And if you can, go ahead and edit somebody else's mission. Pretend like you're working on the mission and you have done an update. So change your hat, say you're now operations or logistics or planning, whatever. Go ahead and make an update to the mission so you can see what it's like to edit someone else's mission. Actually, I'll just look at Betsy's here. Betsy did an outreach site. Excellent. Magistrate Mary Robinson requests that we send casework to open cases for people who lost their homes. You see here, so you may have different views depending on how your computer goes. This is how it generally looks for me. Where it puts them in 3 columns. And I've got some great information on the Sonoma County mission. So go ahead and punch in your missions.
But you'll see, I could not put in recovery, even freeform, it wouldn't keep it.
Well, Betsy, I'll fix that right now as we're going. Betsy, if you try again and refresh, it will now have recovery. That's how fast we can change this.
Beautiful. Here's how do we, oh, edit.
Excellent. I'm seeing some more missions. Here we go. I've got 7 missions. Excellent. Thank you, everybody, for putting in missions. Who's doing it? I've got Susan. Looks like Susan, Marcus, Dan Doe. He might be a mission owner. Drea, Brad, Betsy. Well done, everybody. Sherry, I think it's time to hand it back over to you.
Sorry about that. Rookie mistake. Forgot to come off mute. Thank you, Luke, very much for that excellent presentation and introduction into the mission tracker. We are going to get more practice using this tool in future sessions, definitely in the final session that includes the exercise. So I'm really excited everyone got a brief introduction to it and got to dabble in there. Luke, it's my understanding that this will stay live so people can go in, practice, play with other people's missions, act as if you have an update, you've taken over. In the EOC, maybe you're working B shift, taking over from A shift, and you're stepping in and working that mission. Or maybe it's that you're relieving somebody that's now ready to go home and you're taking on that mission. So I would say one of the very important things when you come on board is getting yourself familiar with all of the missions that are currently being worked and finding out from the person who's leaving for the day or for the rest of the operation, specifically have them answer any questions that you might have regarding any of the specific missions that are being worked at the moment, especially if Red Cross has taken ownership of those, so that you can make sure that you understand who all the players are and can follow it through to fruition, closing those loops, as a lot of the job directors like to say. So thank you again for donating another time, another hour. I hope that you got a lot out of it. I know I certainly did. I've used the mission tracker several times, but I can never get enough practice using it and sharing it with others. It's really important that we also be the communicators and the trainers of the tool once we get on a mission and we understand how to use the tool effectively. So watch for the training Luke was talking about. And I look forward to seeing you next Tuesday when we have our first discussion that gets into the best way to start facilitating conversations with our community partners to meet these needs, especially when we're just facilitating the conversation and not necessarily meeting that need ourselves, being the Red Cross. So thank you again, everyone. Have a terrific Tuesday afternoon, and I look forward to seeing you then. Cheers.
Thanks, Jerry Lewis.
Thank you so much. Great job.
Thank you, everybody.
Bye.
Take care. Thank you again, Luke.
Thank you.
in.
Say bye to everybody. There you go.
Bye, boss Nico. There he is.
Thanks
Oh
to the